Hi everyone, thank you so much for having me here today. My name is Emily Mamo. I've been a registered nurse for over 20 years and have worked in many specialties, including respiratory medicine, cardiothoracic surgery and intensive care. Although I really loved my job and the challenges that it brought me every day, as time went on, I felt I needed something different, which is why for the last 6 years I've been managing patient support programs with Sonic Nurse Connect. Earlier this year, I began managing a program called Care for Rare. For those of you who don't know or who haven't heard of us, Care for Rare is here to provide ongoing support for people diagnosed with Pompe disease and their parents and carers at any stage of their journey and regardless of whether or not treatment has been commenced. This is a free, comprehensive and patient-focused program developed by Sanofi Genzyme, who understand how overwhelming a rare disease diagnosis like Pompe can be. So let me tell you a little bit about what support I can offer as the program manager for Care for Rare. First of all, I'm here to answer all kinds of questions about your diagnosis. This is the kind of thing that's going to be particularly valuable to people when they or their loved one is first diagnosed. There's bound to be heaps of questions that you need answers for. Sometimes there's just way too many to remember to ask when you're with your specialist. So I'm here to manage that overflow. I may not have the answer straight away, and there may be occasions where I won't have one at all. But please be assured, if you reach out to me, you will get a response, and I will do what I can to help you find the answers you're looking for. I'm also here to help you navigate your way through the tests and treatments that are such a huge part of having a rare disease like Pompe. Working with you to understand what tests you're likely to need, where to go to have them, what's involved, what the results mean, and working out what to do next is all part of this service. If you are starting enzyme replacement therapy, I can also help you work through the life-saving drugs application process. Living with a rare disease is going to take some adjustments, and there may be some changes that you need to make to things like diet and exercise. I'm here to guide you through these changes by providing information if and when you need it, and by giving you some emotional support and encouragement. I'm also happy just to be here to listen when you need to chat to someone who appreciates how complex your disease is and to acknowledge the physical and emotional impacts you may be experiencing. If you're looking for a little more than I can offer, I'm happy to work with you to find out where to go to get the right kind of support, for example, through services like the NDIS. With the exception of your specialist, many healthcare professionals may not know a great deal about your disease because it is so rare, something I'm sure many of you have already experienced. With this in mind, the last thing I want to offer you is the knowledge that you have somewhere to turn when you need help explaining your disease to a care provider, or if you're seeking some advice from someone who knows your disease process well before making certain treatment decisions. This program, Care for Rare, is here for you and is available to both Australian and New Zealand patients and families. For those of you who would like to reach out, you can contact me via email at enzyme@careforrare.com.au. There's also a toll-free number, 1800 369 963 or 1800-ENZYME. However, this is only available to Australian residents and during business hours. I'd love to get to know you all a little better, so please drop me a line, introduce yourself, tell me a little bit about how you got to where you are with your diagnosis, where you are now, and most importantly, what kind of support I can offer you. The more I get to know you all, the more information I will have about how Pompe disease is impacting you, and ultimately, the more primed Care for Rare will be to help. Thanks.
Awesome. So we have Nurse Emily here with us live today. So hi, Emily. Thanks for joining us.
No worries, of course. Thanks for having me.
No worries. We've just got this bit of a live session now. So if anyone has any questions for Nurse Emily, please feel free to pop them through in the chat function. I know that there was a few waiting for Nurse Emily, so feel free and we'll go through. Okay, here we go, one already. So we do have a question on diet and exercise for Pompe patients. Do you have any general suggestions?
Diet and exercise. Yeah, look, I know that the recommendation is that you need to have low carb, high protein. Look, this is very easy to say that's what you need to do. It's not easy to do. There's a lot of, I have actually found a website that I've been looking through just to get an idea of how to manage that kind of requirement. And look, it's a tricky one. Getting in touch with a dietitian is probably the best way forward. A lot of the metabolic clinics at the major hospitals will have a dietetic service that you can hook into. I've actually tried to get in touch with some dietitians around Australia at the various referring hospitals. I haven't had a lot of bites yet though, but it is something that I'm looking into to try and get some more information so that I can share that with everyone. So yeah, look, it's just a matter of doing a bit of research through some of the diet websites. Diet Doctor was one of the ones that I looked at, which was quite good. I have actually tried to do it's almost like method acting, doing a low carb and high protein diet myself. Oh boy, it's tough. It's tough to do. You know, carbs are very delicious. We all know this. So yeah, look, it's just something that I can help work through. We can look at recipes and things like that. But yeah, send me an email and I can have a look specifically, I guess. And yeah, we can work with you that way. Okay.
Awesome. So that is good to know. Now, a couple have popped through quite quickly, actually. So the next one is, what would you suggest for patients who are frightened of needles?
Look, the first suggestion I have is you're not alone. Needles are horrible. Nobody likes them. And if they say they do like them, they're lying through their teeth. Look, not necessarily needle phobia, but people who aren't fans of needles, it happens all the time. As a nurse, I'm very used to people being afraid of needles. I think the most important thing you need to do is when you're actually there with the clinician is to let them know that you are not comfortable with the situation. Obviously with enzyme replacement therapy, if that's what you're having, and all of the various needles that you need to have blood tests, it's unavoidable. Having a bit of a think about what it is about the needle that is upsetting you, that's causing distress, and acknowledging that and trying to work with that very, very slowly is probably a good idea. Things like deep breathing, forced muscle tension to try and get you to relax physically, they're all techniques that I would encourage. But I think the most important thing is just to let the person know that you're not comfortable, and they will know. They will position you properly, they'll lie you down, they'll distract you, all of those things that you need just to keep your mind off what's happening. And getting over a fear or a dislike of needles is not something that's going to come quickly. It's something that you probably need to spend a bit of time on. And I do have some bits and pieces here that I can share with people if they like, just some tips that I'm happy to email out if people would like. So yeah, send me an email and I can forward some stuff on to you.
Perfect, thank you. That's a very valid question.
Very valid.
Very. Yes. So we do have a couple more. So, this one's interesting. Do you think that we will ever have access to home infusions?
Yes, I know, the gold nugget. This is something that came up just as COVID sort of descended upon our shores last year. We did look into it. We looked into home infusions, and we have since the other program that I manage, which is Home Infusions, came about. It was always something that was in the background. However, the issue that we have is getting approval with the TGA, the Therapeutic Goods Association. So they essentially are the governing body with regards to where and how infusions of this nature are conducted. And the side effect profile, I think, of Myozyme was the one thing that they were just a little bit concerned about. Home infusions, you have to think you're not in a clinical environment. It's a very uncontrolled environment. You're often there just you and the nurse. And if something happens in a hospital, you can hit the button, you can call the nurse who's in the next bay to come and give you a hand. At home, it's a little bit different. So look, one of the requirements that they asked for was oxygen, and we don't carry oxygen. The nurses don't carry oxygen to the home. We did also look at, as an alternative for this particular infusion, having it as an out of hospital infusion. So using, say, a private infusion clinic. It hasn't gone away. So it's still there. It's still bubbling away. And it's something that does get raised regularly. So, yeah, I mean, I would love to be able to offer it at home. That would be brilliant. But,
yeah.
And I think also the preparation of the medication too, because it can be quite fiddly to put all of the vials in. Look, it's just one of those things. It's there. We're working on it, is the best I can say. So yeah. Fingers crossed. I'll keep you all posted, and you'll all be the first to know. I already had actually a clinician in Queensland ask me about it, because I introduced myself to say, look, this is what I do. You know, we've got this Care for Rare phone service program email for Pompe. If you've got your patients you'd like to refer. And within 5 minutes, I got an email back saying, are you doing home infusions? And I had to let her down very, very gently. I said, no, I'm sorry. That's not one of the things that we do. But and she was very disappointed. She goes, oh, dang. She got very excited all of a sudden. But yeah, so it's something it's always in the back burner. But yeah, I'll keep you all posted.
Fingers crossed we will get there one day, because I know it'd be life-changing for a lot of our members.
It will be, yeah.
All right, so quite a few more coming through. In regards to the dietitian services that you mentioned before, is that something that would apply through the NDIS?
You can. Yeah, dietitians are available through the NDIS, and you can get a Medicare care plan for dietitians and dietetics. It's the sort of thing that you can get through your GP. But obviously, if it's something that you'd like to investigate, let me know, and I can help you work out what you need to do. So that's sort of where I lie within this program, is just sort of, you give me what it is that you need, and I work with you to get it done. And the dietitians, not a lot of them will know about Pompe, absolutely, and that's the challenge I think that I'm having as well in this role, is reaching out to dietitians across the country, and then looking at patients that require low protein diets, not high protein diets. So it's a very different kettle of fish. The metabolic services at the major hospitals should have a dietitian service as part of the clinics. So if you're finding that where you're going that's not happening, let me know, and I can make calls. I can find out where that referral needs to go. And often it is just having that time to sit down and have a chat to the doctors about what's happening, and just so that they know that I'm out here. The program is very early in its stages, so I'm building relationships as I go along. Yeah.
I think you've actually just touched on something. Alison just popped through saying in regards to dietitians at certain centres, a lot aren't suitable for Pompe, and that's because they generally don't understand the disease as such. So I think you touched on that. And as you said, it's more just picking the right one, I think.
That's right. And having the right approach, and obviously with dietary intake as well, particularly with Pompe, if you're getting fatigued, it's very difficult to get the amount of protein in that you need, and to balance it correctly with the right amount of fibre and all of those sorts of things. It's not just adding one element to your diet, it's trying to find the right balance. So look, as soon as I have information from someone who specialises in dietetics for Pompe patients, that's something that I will definitely make available to people if they need. So yeah, leave it with me.
Some more questions about exercise, so going back to that. So someone's popped through, do you know anything about the intensity and the duration of the exercise? And then following that up, you could probably answer both questions in the one go. What should we look for in a physio? So similar to the dietitian, I guess, that you've based on knowledge of the disease.
Sure. Yeah, look, physios again, they really do need to have a bit of an understanding about the disease process. And I guess that's another part of where my role fits in here is if you've found a physio that you're connecting with, but you don't feel that they're really understanding the condition, I'm happy to speak to them. So this is where I come in terms of your advocate. So to provide them with that information and to guide them, clinically, where they can look to get a greater understanding of what the needs are. Certainly with metabolic clinics at the major referring hospitals, I know I keep going back to that, but really they're the gold standard at the moment. They should have, as part of that clinic, physiotherapy. So it's physiotherapy, dietetics, psychology, often social work, occupational therapy. So there's lots of different things that should be accessible to you, and for people who are, and clinicians who are across the disease process. But yeah, look, where that's not possible, please reach out and let me know, and I can try and find somewhere for you to go, or something, to reference. And look, sometimes it's not necessarily just about the physio, it's about OT as well. So there's different stages of the disease progression where physio might be more beneficial than OT, and then vice versa as things change. So and getting back to duration and intensity, they're the sorts of things that you really need to have prescribed. It is a prescription, I think, because it is easy to fatigue when you don't have the right muscle control. So yeah, it's a tricky one. It's very independent, so it really does come down to an individual assessment of what your needs are and what you're capable of doing as well. Anything is better than nothing, but it's important not to go overboard, because people like me, I tend to go full throttle and then hurt myself, and then I can't do anything for 6 weeks. So counterproductive.
Yeah, definitely.
But that's as much as I can offer on that, I think.
I like this question. This is very, very hopeful, I would say. If we are ever allowed to go overseas again, are there are there any exchange programs for receiving infusions whilst away on holiday for longer stints? And is this something that you could help with?
Look, there possibly is. I'm not aware of any, and that's certainly the sort of thing that I would look into if and when the situation arose. Look, certainly with the infusion programs that I manage for the home, we have patients that travel within the country, and we can certainly organise and liaise with specialists about getting clinic time and that kind of thing. So that's not something that I'm unfamiliar with. Overseas, possibly slightly more complicated, but again, it's the sort of thing, unless I knew what the situation was and where people would be travelling, I'd probably just have to do some groundwork. But again, that's what I'm here for, is to do some of that groundwork for you. But yeah, great question. And yes, fingers crossed we can travel overseas soon. I'm banking on it.
I agree. So a couple more. So there's just another, I don't think this is a question, it's more a comment, just saying NDIS pays for the dietitian's cost. It can be included in the plan. So thank you, whoever put that in there. Are you aware of any research initiatives involving professions such as dietetics and physiotherapy to look at, and what is most effective or appropriate?
Look, I'm not across anything at the moment, but yeah, something I can look at. But yeah, unfortunately, no, I'm not aware of anything. No.
And the last one at the moment, so if there's any other questions, please feel free to pop them through. But someone has asked, please provide your email and phone again so we can contact you with all these questions. So if we've got that handy, I'm sure we can get that sent out to everyone to make sure that it's all there.
Yeah. So the email, if you want me to read it out again, it's enzyme@care4rare, and the 4 is a number, .com.au. So enzyme@care4rare.com.au. And the phone number is actually 1-800-ENZYME. So if you've got one of those fancy phones that has letters and numbers, you can type that out, or it's 1-800-369-963.
Beautiful. Okay. And Renee, our website expert is
Yes.
very quick. She has actually just messaged me and said the details will be live on our website on Monday.
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 Wow.
So thank
Fast
you,
worker.
Renee. Messaging
Yeah,
me on the side there. So thank you for that. I think that is all of our questions at the moment. Anyone else? No.
That's all right. Look, any
Cool.
questions that anyone has, please send them to the email address, even if it's just 3 lines. And I'll have a look as the week goes on.
Beautiful.
But yeah, you'll always get a response. So if
Awesome.
there's anything. Okay.
Cool. Well, thank you so much for joining us today and taking time
pleasure.
out of your Saturday to come and speak to us. And
No problem.
I have no doubt you'll have a few emails next week.
Excellent. I look forward to it.
Yeah, beautiful. Thank you so much.
My pleasure. Bye, everyone.